Staphylococcus is not a sexually transmitted infection, my dear.
What?
I can authoritatively tell you that.
Come off that.
Hello, people. So today, let's talk about a very simple topic. As simple as it sounds, it could really be very scary when people hear about it. It's about Staphylococcus. Yes, Staphylococcus. That's how they call that. When you hear some patients, they come to you with some lab results. Hey, doctor, I have a Staphylococcus. And some of them, they are so scared by vendors, and they tell them that it is a sexually shared infection. There is nothing like that. Staphylococcus is not a sexually transmitted infection, my dear. I can authoritatively tell you that. Go and make your research.
That is double quarantination.
So, what is a staph infection? A staph infection is caused by a bacterial bug which we call Staphylococcus. Naturally, in about 20% of normal healthy people, they could have Staphylococcus aureus, usually on their skin, on the vaginal skin, on the armpit, on the buttocks, and even in their nostrils. Yeah. It could stay there. Most of the times it doesn't cause any problem and people live normally, but sometimes your immune system is really not that good, probably because you have some infections like HIV, or you have conditions like diabetes, or you are on some medications, we call that immunosuppressants for some disease conditions like autoimmune diseases, where you have the body produces proteins that attack its own cells, or sometimes in pregnancy or even after delivery, the immune system could be affected, or even some women who abuse antibiotics. So in that situation, you could have a heavy growth of such kind of organisms. And then naturally, if you do have that bacteria, it could just clear on its own and you do not need any treatment.
What are you trying to say?
How do you get infected? Let's come to that. Now, you could get infected, like I said, it could really colonize and be on the skin. So when your hygiene is not good, you do not wash your hands, you just keep on taking things, eating things when you don't wash your hands, it could put you at risk of that. When you share towels or toothbrushes with people, it can put you at risk of that. When you have a cut on your skin and you don't take care of it very well, the infection can burrow through the skin and get into your blood and cause a serious condition, especially if your immunity is not good enough.
Is it your business?
Common things occur commonly. In the Staphylococcus infection, in some serious conditions, it can lead to what we call a toxic shock syndrome. Let me not get to that.
What's he saying?
Common things, like I said, occur commonly. So, when you are told that you have a Staphylococcus infection, sometimes women could present with these common symptoms. You could have boils around your vulva, the skin down below. You could have some boils there. Usually that's the common presentation, or some changes, redness on the appearance of the skin there. And sometimes you could have, if it's not treated, there could be some pus coming out there. Now the simple treatment is just antibiotics, nothing else, just antibiotics.
Yeah, you for talk and since now.
So when you have these symptoms, you just get to your health professionals who is going to assess you and recommend the right treatment for you. Now, how can you avoid this? It's simple. Just make sure that you stay clean and healthy. Try to wash your hands at all times. Use soap and water to wash your hands. Don't share towels with people. Don't share toothbrushes with people. Any point you see these symptoms still persist, especially when you have the boils or when you have the skin, changing in the color, peeling around the skin there, just go and see your doctors. And when you get the results that you have this Staphylococcus infection, don't get yourself so worked up. It's not that serious. Do take care of yourself, stay healthy and beautiful. Bye.